Hypertension by Iffy, Iris, and Shada.
Yeah.
Come in.
Hi, Shada.
Oh, hi, Dr. Artuna.
I've noticed that in the past couple of physicals you've had, that your blood pressures came out kind of high. So I want to check it again. Is that okay?
Yeah, that's fine.
Okay, Shada, your blood pressure was 145/96. That's still very high. I'm going to have to go ahead and diagnose you with hypertension.
Oh, no, what is that?
Let's begin with what is blood pressure. Blood pressure is the pressure your blood exerts against your blood vessel walls as your heart pumps. A normal blood pressure value is 120/80. You're probably wondering what these numbers mean. Blood pressure is measured in milliliters of mercury, mmHg. The top number is called systolic pressure and represents the pressure at the peak of each heartbeat. The bottom number is called diastolic and represents the pressure when the heart is resting between beats. Hence why we have 120/80 as an example. Now, what is hypertension? Hypertension is defined as a persistent abnormally high blood pressure reading of 140/90 or greater. There are 4 classifications for blood pressure. Normal was previously discussed. The other 3 consist of prehypertension, stage 1, and stage 2. The ranges for each classification are listed.
The cause of hypertension can be classified as either primary or secondary. Primary hypertension is elevated blood pressure without an identified cause and accounts for 90 to 95% of all cases. The remaining 5% of cases are attributed to secondary hypertension, which is elevated blood pressure with a specific cause that can be identified and corrected. Some of the causes include kidney abnormalities, structural abnormalities of the aorta existing since birth, and narrowing of certain arteries.
Signs and symptoms of hypertension. Unfortunately, hypertension does not present itself with many symptoms until the consistently high blood pressure begins to affect your organs. That is why it is commonly referred to as a silent killer. However, there are secondary symptoms, and these include fatigue, reduced activity intolerance, dizziness, heart palpitations, chest pain, and shortness of breath.
Did you know that approximately 68 million adults in the United States suffer from hypertension? Each year, an estimated 2 million people are diagnosed with this disease.
There is a higher incidence of hypertension in African Americans and whites who reside in the southeastern regions of the United States. Men are more affected in younger adult population, whereas women are more affected in the older adult population.
There are controllable and uncontrollable risk factors for hypertension.
Uncontrollable factors consist of age. As you age, blood pressure rises progressively. Gender. Hypertension is more prevalent in men. However, after the age of 55, hypertension is more common in women. Ethnicity. Hypertension is 2 times higher in African Americans than in whites. And family history. Some controllable risk factors consist of obesity, excess dietary sodium, excess alcohol consumption, lack of physical activity, stress, cigarette smoking, diabetes, elevated serum lipids, and a sedentary lifestyle.
So how can we prevent hypertension? Lose weight, reduce your sodium intake, limit alcohol consumption, include more fruits, vegetables, and low-fat dairy products in your diet, adequate calcium intake, quit smoking entirely, and get your stress under control.
Some of the ways to detect your hypertension is by consistently monitoring your blood pressure for findings that are equal or greater than 140/90. Basic laboratory studies are also performed. You can identify or rule out secondary causes of hypertension. You can evaluate target organ disease. You can determine the overall cardiovascular risk and establish baseline levels before initiating therapy.
Lifestyle plays an important role in treating your high blood pressure. If you successfully control your blood pressure with a healthy lifestyle, you may avoid, delay, or reduce the need for medication. The following are evidence-based measures that one can take to treat hypertension. Lose extra pounds and watch your waistline. Exercise regularly, at least 30 to 60 minutes per day. Eat a healthy diet. Reduce sodium in your diet and limit the amount of alcohol you drink. So, depending on classification, individuals may need to self-monitor blood pressure, require antihypertensive medications to achieve their goal blood pressure. How does hypertension affect dimensions of health? Hypertension is a risk factor for more than heart disease. It can quietly damage your body for years before symptoms develop. Hypertension can affect multiple dimensions of health, such as physical, social, and intellectual. Hypertension can affect you intellectually by leading to damage to your brain. Just like your heart, your brain depends on a nourishing blood supply to work properly and survive. But high blood pressure can cause several problems, including a stroke, dementia, and mild cognitive impairment. From a social aspect, hypertension can affect one's life because hypertension can affect damage to your eyes, causing optic neuropathy and retinopathy. It can also cause a sexual dysfunction in both men and women. Hypertension also affects other areas of the body, leading to such problems such as bone loss and trouble sleeping.
There are many resources available to help with the prevention, detection, and treatment of hypertension. A few include the Weight Watchers program or diet.org, which are programs to aid in weight loss. Also, the American Heart Association and American Stroke Association have developed blood pressure monitoring programs which are located throughout the United States. WebMD is a website that offers tips on food and provides a fitness planner to individualize physical activity. There are also online emotional and spiritual support groups like Inspire and Daily Strength. One of the primary goals of rehabilitation for hypertension is to reach a target blood pressure after the initiation of treatment. It is important to follow up with the doctor once a month until the goal is reached. It is also important to continue to see the doctor every 3 to 6 months for monitoring. For a healthy adult, the target blood pressure would be 140/90 or lower. If an individual has chronic kidney disease, diabetes, or coronary artery disease, the target blood pressure would be 130/80 or lower. If an individual's heart isn't pumping as well as it should, or they have a severe chronic kidney disease, the target blood pressure would be 120/80 or lower. By reaching the target blood pressure goals, one can reduce the incidence of cardiovascular disease and associated morbidity and mortality. It is important to call your doctor when your blood pressure is higher than normal and you have severe headache, chest pain, numbness, or tingling in the face or limbs.
Thank you so much, Dr. Tuno, for giving me all this information about hypertension. I'll be sure to follow all these guidelines and see you next month.
See you next month, Shada.